Yes. In the beginning, I was trained in the Orthodox way of managing childbirth. And for a number of years, I did it the Orthodox way, in the hospital with all the interventions and so forth. And after a number of years of this, including teaching at the university, I joined the World Health Organization, and I was in Copenhagen, Denmark, and I met a Danish midwife, and she asked me if I had ever seen a home birth. And I said no. And she said, would you like to see one? I said, oh yes, I would love to. So she arranged and invited me to go with her when she was giving a home birth. And I just sat in the chair in the corner and watched. It was a mind-blowing experience. By the time that birth was over, I realized that this was the first time in my entire career I had ever seen a real birth. And that's what birth is about. And I didn't know what birth was about. And I had to go back and basically start all over and read and study and find out what birth was really about. And I discovered that birth is all about women. And birth is in the women's world. And men have always been on the outside when it came to birth. And it was only very, very recently that the men have invaded the world of childbirth and have, of course, being men, they want to take over and control everything. And that's why they put it in the hospital, and that's why men begin to come with all the interventions and controls. And we ended up not even knowing what real natural birth was. But that's how I found out. There are two main reasons why there is a tremendous gap between what the scientific evidence says should happen at birth and what the obstetricians do at birth. The first main reason is because obstetricians have never been really adequately trained in the scientific method. I know, I went through it and I've seen hundreds of others go through it. You are not trained as a scientist. You're trained to do what the other guys are doing and to follow on and continue the routines as they have been evolved by the obstetricians. So you don't really pay any significant attention to what the scientific evidence is showing. That's the first problem. The second problem is it's all about money and prestige and convenience. It's all about the personal needs of the obstetrician. And the obstetrician will get more status, will get more money by doing more. And so the obstetrician is trained as a surgeon. He's a surgeon. He or she is a surgeon. What do surgeons do? They cut. And so of course they want to cut. So they're going to cut more and more. And if they cut more, they get more money, they get more prestige. The hospital gets more money, the hospital gets more prestige. And this is why there is this huge gap between what we know should be done and what is going on. The World Health Organization recommendations were originally made in 1985 at an international conference where there were 50 experts from around the world, including not only obstetricians, but also epidemiologists and scientists, also midwives, many midwives, and also women consumers. And we reviewed the entire world's literature and made these recommendations. The recommendations became very important in the real world of obstetric practice and midwifery practice. Then in the beginning of this century, the World Health Organization did another international review of all the scientific evidence and considered all of and did a survey of all the countries in the world to see what they were doing with regard, for example, to cesarean section rates. And then we analyzed all these rates and we published them in a 2005 paper, which showed that the original recommendation of between 10 and 15% of all births should have cesarean section continued to be exactly true. That is, if it goes below 10%, the maternal and fetal mortality goes up. If you go above 15%, the maternal mortality and the baby mortality goes up. So it should be between those limits. So in other words, no, these are no longer relevant. They continue to be just as relevant today as they were originally. And many obstetricians don't like these recommendations because then they can't do everything they want to do. And so they come up with excuses why we don't have to follow those damn things anymore. And one of the excuses is, oh, they're not relevant anymore. They are relevant. You know, there has been free drinking and eating in Western Europe, North America, and all over the industrialized world for at least 2 or 3 decades. And anybody who still talks about the Mendelssohn syndrome is way, way behind. Because the Mendelssohn syndrome was originally described when they were using general anesthetic during labor to take the pain away for the women. And with general anesthetics, you would sometimes get vomiting. And sometimes the vomitus would go and be aspirated, and that would be the Mendelssohn syndrome. This is no longer a concern whatsoever and should not be used as an excuse to continue a very outmoded practice. There has been an extreme medicalization of birth. And it began when birth was moved from the home into the hospital in the 1950s and 60s. Now, there was no scientific justification for this move. It was done because the doctors were in the hospital and they wanted to take over maternity care. They wanted to push the midwives out, and the way to do that was to bring it into my palace, the hospital. And that is why it was done. And then as soon as they got the birthing woman in the hospital, they began with all the interventions. More and more induction, more and more this and that, and finally more and more cesarean. It continues to this day. They have stolen birth from birthing women and put it under their control, and they are making it more and more a medical procedure, which it is not. Birth is part of the normal life cycle. And it would be like if my wife and I had a 2-year-old baby and we wanted to go out for the evening and we needed a babysitter, so we call up the local pediatric surgeon to come and babysit. We medicalize being a baby. And so we go out to dinner and the baby begins to cry and the pediatric surgeon comes with the injections. He medicalizes babysitting. That's what has happened with childbirth. We've medicalized it. And it has very, very little to do with the technological revolution. And as a matter of fact, there has been improvement in the number of women dying and the number of babies dying around the time of birth. But the improvement has come mainly from better social conditions for the woman and the family, better housing, better diet, and so forth. And to a lesser extent, certain basic medical treatments such as antibiotics or say blood transfusion. Those save lives. It has never been shown that electronic fetal monitoring saves lives. It has never been shown that induction saves lives. So the technology came because it was the doctors, and the doctors loved toys and they loved surgery and they love to do all these technical things, and so they come with it and they steal the birth from the baby, from the woman. As I said earlier, there is very, very good scientific evidence from around the world that shows that the safest amount of cesarean section is between 10 and 15% of all births. And the 10% doesn't really apply except in the third world, where they don't have enough doctors and hospitals and so forth. But the above 15% is a serious problem in the highly industrialized world because of all the doctors that love to do cesareans. And so, in fact, cesarean section is safer today than it was, say, in 1950. But that doesn't mean that cesarean section is safe. It is safer than before, but it is still has serious risks for the woman and for the baby. And the maternal mortality, which is the risk that the woman is going to die, is 4 times higher in cesarean than in vaginal birth. But some of that is because some of that cesarean is done for real emergencies. So if you just look at the cesarean that is done electively without emergency, you find that the risk of the woman dying is still over double the vaginal birth. So there is serious risk for women to die from cesarean. There's also serious risk that the baby will have serious and life-threatening respiratory problems. You see, when the baby comes through the birth canal, its lungs are squeezed, and it squeezes out all the fluid that's in the fetal lung, so that when the baby comes out and takes a breath, the air comes in from the outside and goes into the lungs, and the baby breathes normally. If you don't squeeze, but you just lift out with cesarean, then the baby takes a breath and the air goes and boom, it can't go in because the lung's full of fluid. So then the baby has to struggle and struggle to get rid of that fluid and replace it with the air. And sometimes this process gets into difficulty and you get respiratory distress. And respiratory distress as a newborn is one of the biggest causes of newborn death. So, even today, cesarean section has serious risks. Birth belongs to the woman and the family. And they are the ones who should be in control of everything that goes on. They are the ones who should make the decisions about what will or will not be done. And the woman should be in the center. And the doctor and the midwife are over here on the edges, assisting as they can. So the first step for humanized birth is to keep the woman in the middle, keep her in control, keep her deciding what's going to happen. And the doctors and the midwives need to learn how to let the woman do this. This is very easy for the midwife because the midwife is very used to working as an equal with the pregnant woman. But the doctor is not used to working as equal with a patient. The doctor is in charge. And so it's very difficult for doctors to give up their power and control and status. And yet that is why it's such a difficult thing to have humanized birth in the hospital, because the hospital is the doctor's castle. The doctor's in control of everything that goes on there. But it's the woman's body, it's the woman's baby, it's the woman's family, and the doctor has to learn to do this. Okay, it's a very important thing for the woman to be in control, including to be in control of who is going to be there to assist her. And is she going to have a midwife? Is she going to have a doctor? And there should be a program in the community that begins in the schools with little girls and all the way through, so that they learn about birth, they learn about midwives, they learn about all of this, so that when they find that they are pregnant, they are well educated and well able to make a educated choice about their own birth. And generally speaking, for the 80 to 90% of all birth that is normal, there's been no medical problems during the pregnancy and so forth. For those births, it should be a midwife. There is absolutely no business for a doctor to be at a normal birth. As a matter of fact, everything about being a doctor is against normal birth. We are taught as doctors for diagnosis and treatment. Well, what's diagnosis? Diagnosis is finding something wrong. And then treatment is doing something about it. And yet birth, there's nothing wrong. It's normal. And, you know, sure, in a small percent of cases, something can go wrong. But, you know, in a small percent of cases, something can go wrong with sexual intercourse. But do we have doctors and nurses standing around the bed while a man and woman are making love? I mean, of course not. That's part of the normal life cycle. That's part of being human. That's part of life. Well, so is birth. And so for all of the 80 to 90% of births that are normal, it should be a midwife. Because a midwife can give the woman the control and still be there to recognize problems if they do happen to arise. It does not need to be in a hospital. As I said earlier, birth was put into the hospital for no good scientific reason. And it should not be in the hospital. This 80 to 90% of women do not need to go to the hospital to have a child. It can be in an out-of-hospital birth center, or it can be at home. Home birth is absolutely safe, and there is a mass of excellent scientific research that proves that for the 80 to 90% of women who have no medical problems, home birth, planned home birth, is a perfectly safe, rational option. There is a real domino effect. If a woman comes into the hospital to give birth, and first of all, they change her from being a human to being a patient. They take off all of her clothes, which is not necessary. They put on a hospital gown. They put her in a room, a hospital room. They put her in bed. She doesn't need to be in bed, but they put her in bed. They treat her like she's sick, and they treat her as a patient. And so they come with the induction. And the induction starts very powerful labor. And that causes a lot of pain. So here comes all of the drugs for pain. And then when it's time for the baby to come out, they come and cut the woman open. Why? And episiotomy used to be 100% in some countries. particularly countries in Eastern Europe. Now in Western Europe and in most of the industrialized world, it's maybe 10% of births really truly need this episiotomy. It is still 60, 70, 80% in some countries in Eastern Europe. Episiotomy has been shown scientifically to give more pain, to give more bleeding, to cause problems with the sex life in the future of that woman. It should not be done unless there's a serious problem. But they do the episiotomy, and then they come with the forceps or vacuum, or they come with the cesarean. So it's boom, 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 boom. One thing leads to the next, which leads to the next. And so there's far more cesarean after induction, for example. So one thing leads to the next. And this all needs to stop, because every one of these interventions carries a risk. And, epidurals for pain. Women die from epidurals. They don't tell a woman that when she's in the hospital and they want to give her an epidural. Do they tell her the real facts about epidural? That she might die? They never say that. She might have a grand mal epileptic seizure. They don't tell her that. But it's true. It's in the science. It's there. It happens. And so if the woman is in charge and she's told the full truth about the risks of all these interventions, she's going to start saying no. If you give Cytotec for induction, it causes very powerful contractions of the uterus, much more powerful than normal contractions. And once in a while those are so powerful that they cause the uterus to blow up like a blown out tire and rip open. And then the baby comes out of the uterus into the woman's abdominal region. This is very, very serious. There's a very high risk that the woman will die. There's a very high risk the baby will die, as if there is a uterine rupture. And this is a very important reason never to use Cytotec during labor. The reason why we need black boxes so much in this country is so that we can document what's going on. You see, there is a widespread notion among doctors, and they're getting to get it into the public now, that cesarean is perfectly safe. Don't worry. And I was on a national television program once, together with the president of the American College of Obstetrics and Gynecologists. And during the discussion, he said that there was no risks for the babies with cesarean. And of course, I immediately jumped in and started giving all the risks there were for the babies. But the problem is, he really believed that. So you see, the doctors really believe that cesarean is absolutely safe. They are not recognizing how many women are dying. And it needs to be documented for the women and the doctors, particularly for the women, because if the women will begin to understand that cesarean carries serious risks, they might accept the risk for themselves. They won't accept the risk for their baby. And when they hear that there's a bigger chance that the baby will get in trouble with cesarean, they're going to start saying no about cesarean. And then the cesarean will start to come down. My goal for maternity care after all of my years of being in the middle of it, is that birth should belong to the woman and her family, who will have absolute control over everything that goes on. That will never happen in the hospital. I'm sorry, it will never happen in the hospital because the doctors are in control. So we have to get birth the hell out of the hospital. Now, for the 10% or so that have a serious medical problem, they need a hospital and they need the care that goes on there and they need to go there. But for the other 80 to 90%, they shouldn't go near a hospital. They should either be in an out-of-hospital, independent birth center with midwives, or else at home with a midwife coming to attend. And that is what should happen in the case of birth in the future. And it will automatically mean that the use of all these interventions will go down.